Good morning. My name is Richard Wexler and want to invite you to episode 16 of our podcast entitled Caring in America. So, with each episode, I do a little recap of who I am and why we're doing this. So, if you recall, about 18 years ago, minding my own business in the software industry, married later, two small children, one 11, one 7, and we start in the summer of '05 getting multiple phone calls from our parents that are exceptionally ill. And we wind up managing their care for 14 more years until the final parent passed away at 96 in 2019. So, quite a journey. And we have a great guest today that I'm about to introduce. Her name is Caryn Isaacs. We're going to be talking about a few different subjects, including possibly some stories that she can relate, whether it's personal or about clients that she's worked with. So Caryn has been in the industry for over 30 years. She's done a lot. She has developed hundreds of healthcare businesses and runs several multi-million dollar companies. She is actually the originator of the term private professional patient advocate. And as a patient advocate, she is with her patient every step of the way, helping them find the accurate diagnosis, develop life plans, and potentially find alternatives. In addition to this, we want to talk about two words, aging icons. And as I said, any stories that Caryn wants to relate. So, welcome, Caryn. Are you there?
I'm here.
So, a little recap. We go back about 30 years. What got you into the healthcare, quote unquote, elder care industry to begin with?
Yes, well, thank you for inviting me. I have been actually doing this type of work since 1976.
Wow.
I was working in doctors' offices, and then I moved to a health insurance company. And seeing the health insurance company, I was able to get to really understand what the payment process was, and I developed one of the first computer systems for the health insurance industry
Wow.
when computers was still a whole room,
Yes.
um, figuring out how to pay the doctors, and I had gotten really to the pinnacle of where I could go in that business, and I was still only 25 years old.
Wow.
So since I really wanted to be the star of my own show, I decided to start my own company since I knew a lot of doctors from who had been involved in accepting that health insurance, and I knew a lot of companies who either paid insurance or like unions who had their self-insured funds, and I had made friends with everybody along the way. So I was hired. I just told people that I was starting my own business, and I was hired immediately by several doctors to find locations, buy their equipment, hire their staff, and of course help to find them patients, because that's what it was about.
So you, in essence, were a jack of all trades. It sounds like back then. I mean, you were wearing a lot of hats.
Right, all the hats, because that's it. If you're doctors at that time were a one man show, and they needed a lot of help, and so they were young people who didn't have a lot of money to start their businesses, had a lot of debt, And so
And as
instead
you're
of,
saying, and maybe if I'm putting words in your mouth, stop me. But back in the '70s, and you kind of said this, I would assume a lot of the doctors were male. Did you see very many female doctors?
yeah, well, it's interesting. A lot of my clients were immigrants because at the time it was in 1976 was when the law changed that doctors could advertise before it was considered unprofessional. So when they could start to advertise, the ones who were willing to delve into that, either had no prior relationships with hospitals and nothing to lose, so to speak, um, or they were just here. They were very hungry
Well,
people. So I did have a number of women doctors, primarily Indian doctors from India. I had
interesting.
doctors from India, Russian doctors, Pakistani doctors.
So, what was the transition from doing all of that into these two words being a patient advocate? Besides the transition, if you can kind of tell our audience about that, then we can start talking about exactly what a patient advocate does. Because I don't know if many people out there understand what that individual does. I'm not sure if I did 15 years ago, but it's extremely valuable. So back us up. What was the transition?
Yes, well, people, there is no license required to call yourself a patient advocate. Like, there's no license to call yourself a therapist. There are certain licenses out there. There's, uh, a nursing license. You have to pass a test, and have passed a certain amount of education, and then you would receive a license from the state to operate. But there is still no license, actual license, to be called a patient advocate. So what happened was that once I had gotten done this, setting up practices for many many years, and even started a physician owned HMO, uh, I realized that that wasn't going to be the answer. That the insurance companies were going to continue to play around with the fees of the doctors. That the health system, was going to change um, into what I now call doctor in a box. You don't really see a doctor. You have the assist, physician assistant, or you may eventually have no one. You're just going to call up and tell your symptoms, and the box will answer you. So I realized that the patient was going to be stuck without understanding how to navigate this system. And so I started to call myself a patient advocate in about 1980. I had a directory of providers that I had put together to advertise my uh, roster of customers. And on the back, I put, if you don't see what you want, call the patient advocate. And people were calling me that had multiple medical issues. Sometimes it was a financial issue of not being turned down for coverage for something. But more than financial, it was a lot of really complicated medical issues that were not being resolved. What I call, not finding the right diagnosis. How do you find the right diagnosis? When in the old days, you went to your doctor who knew you from birth, and they had all of your records. But now everything is so all over the place, and even with the technology that's come down the pike, to it's still where you're counting on somebody to know everything, and no one can really know everything. So you go to a doctor and they say, "What are your problems?" They're going to basically sell you what they have in their office. They don't know what to tell you about what is out there. And that's when I realized that a person, whether it be called a patient advocate, some people call themselves a healthcare advocate, Some people call themselves a healthcare navigator. The idea is sort of like a concierge, to be able to say, I'm going to find you the things that you need.
Very interesting.
And,
Go ahead.
and so that could be, it could be a family member, it could be a professional. That's why I took the title, the longer title, to say private professional patient advocate, being that I don't work for any particular health system, I don't work for an insurance company, and now the title is catchy, so you will see that those words used in a lot of different contexts, and you want to make sure that if what you need is really full navigation and a unbiased point of view, that you have someone that is acting independently.
Let me ask you a couple questions because, and I think if I'm off subject, let me know, but I think this will parlay into what you're talking about. So let's make an example of older mom. She's in her 80s, she falls, she breaks a hip. I've done episodes about this. She off to the hospital. The kids that don't live close anymore are flying in from around the country, maybe even from around the world. Maybe luckily in this family, there really hasn't been a lot of exposure to doctors, to the hospital, to things that are going to happen within the hospital. From my own experience and your expertise, really trying to help that, and this is along the lines of what you've been doing, really trying to help that family navigate. Okay, mom's in this situation, this is what's going to happen next. We talk a lot about, so mom luckily gets through surgery, which can be difficult with anesthesia when you're beyond 80 years old, and then it's off to a skilled nursing facility. And then what I've found, and you can correct me if you think I'm wrong, that the kids kind of take breaths along the way. Now mom's secure in this skilled nursing facility. Then what's next? And maybe there's more complications than just the hip. Am I totally offline, or am I kind of talking about what may happen?
That it's great to hear it from the viewpoint of the family member, because that's where you would, that this is explaining how most people would enter the system and would see it. An emergency happens, something terrible happened. Now, first of all, they're in the hospital. Now, before they're operated on, what were the options? What actually happened? When did it happen? What was the background of this? Because there might have been a decision to make about whether even to operate. So when somebody is elderly, they may have complications. A person with severe dementia should not be getting anesthesia. So number one that I would say is, oh my God, you let your mother have the operation. I'm probably not going to be able to get her to come back from the anesthesia. I
You
mean,
mean
wouldn't
you
that
mean
be
mentally?
terrible?
You
Wouldn't
mean
that be a
mentally? Go ahead. Go ahead.
Yes,
Sorry. Go ahead.
yes, mentally not come back from the anesthesia. What happens is the first time that somebody to um, comes into the hospital and they're in pain and she's hysterical, the first thing they'll do is give them an antipsychotic, and that's the worst thing you can do for somebody who's has dementia. So first they gave them an antipsychotic. Yes, it quieted them down. They're now in a stupor, and then they're rolled into the operating room, and they're given anesthesia. This person is not coming back, and isn't that a terrible thing? People say don't tell these horrible stories, but
No,
the people who are patient advocate is because something terrible has happened.
my audience needs to understand that, and if I can kind of back up a little bit, and again, if I'm wrong, let me know. But so, mom, whatever her name is, she's 85. She breaks her hip. She has dementia, and I'm not downgrading doctors, nurses, people at the hospital, etc.
Yeah, no,
But
their job is to save her life, right?
right,
Their job is not to save her quality of life.
got it. So I mean,
So
are they?
it's up to the family. It's up to the family, at that point to say, hold your horses. What is this? What is going on? What's going to happen? What were the options? And most people don't know how to bring in the right people to consult with. And that's where you would want to speak to a patient advocate early on.
So again, so that the average family out there understands, it really is, and I'm going to use the word job, it really is their job to be communicating this information to the folks at the hospital. My mom has dementia. My mom has X. My mom has Y. So they're treating her appropriately. And like you say, she's 85. Okay, we're going to rush her into the operating room and operate so she can walk on that leg again. But is that the best decision?
And would she right? And she probably won't be able to walk because she won't understand how to take the instructions at the rehab. So she'll just lay in bed, and then they'll say she refuses to do the exercises. She doesn't know what they're talking about. Right? But my point is that the emergency time is not the time to start getting involved. The time to get started involved is the planning stage. So when the mother is 75, when they realize that they're alone and they're just slowing down some, or the future is that hopefully they would live till 85 or 90 or 100. So planning is the initial thing. And once you've made the plans, and I'm talking legal, financial, and medical plans, then you know what's going on in the hospital. That you would have the proper documentation to show the hospital. You wouldn't have to go through any kind of hoops at the hospital. If you're in the hospital, in the emergency room, they're not going to start talking to you about your mother's, lifestyle. But if you have the proper documentation, you're just going to hand these documents over. This is what we want. This is what gets done. They're legally protected, goes in the chart, and things hopefully go the way you expect.
This is fantastic information. I think, as we've talked about, I use that dirty four letter word plan a lot. I get so much pushback, as I'm sure you have, from folks. But what you're talking about 10 years earlier, maybe even earlier than that, as mom starts aging, maybe dad's passed away, or maybe this is your father and mom's passed away. So if something happens like this incident, she tripped on a stair, whatever it may be, they have the proper documents in place. Because, as you're saying, first of all, they may get to the emergency room too late, but that really isn't the place to be having these detailed conversations. I think that's wonderful advice. And I urge my listeners, please listen to this. And as you see mom, dad, grandparents aging, please start making those plans. Can you talk in a little more detail about that planning and what it should encompass?
Yeah. So, I mean, I would start at 65. I would start as soon or earlier if you're disabled, if you go on disability. If you're going to be getting Social Security and Medicare, then that's a lot of planning as to how you want to access that. Do you want to take early Social Security? Do you want to take a managed care plan for Medicare? These are all complicated decisions that you have to make. So as long as you're taking the time to do that, that's a good time to also make sure that you have all the other documents that you need. And it's a good time to be able to discuss with the person that you're planning for their wishes. before they're demented, before everybody's moved away and no longer really understands what their intentions are. Right then, while you're doing it, you want to have a discussion about what they want in their later life. And that is the first document is the healthcare proxy or the advanced directives. You want to make sure that you're picking the right person. That's a discussion that's, if you're talking about Medicare, people don't mind talking about money as much as they do their health. People are
Sure.
more willing to say, I don't have any money. You'll get it when I die, and you'll find out what I have then. I'm going to spend it all.
Right.
But the realities are most times that doesn't actually happen. So
This is fantastic advice. So I'm not sure if you could relate some stories. Maybe they were really positive because a client you were working with had done all of this. And then as mom went through what she went through with her health, it was very positive. Or maybe you've seen some families where there wasn't the appropriate planning and maybe the outcomes haven't been as positive as the individual plus their family would have liked.
yeah. Well, I mean, I have thousands of stories, so I always like to use the latest one. I have one actually from today. I was called yesterday by an assisted living because a lot of the calls come into assisted living, like they go to a place for mom because they just don't know where to turn. So they saw on television a place for mom can give you advice. They send them to an assisted living, and the assisted living says, well, we don't know anything about the person. We don't know if they're appropriate for assisted living. So they might refer the client to me. And so what happened with this client was that she has been through the hospital, been through the going to the um, assisted living. She was not able to do anything at the assisted living. Assisted living is it usually inside of a nursing home. So if the assisted living, if the rehab, I'm sorry, if the rehab cannot get the person to do the exercises and reach certain steps that the Department of Health and Medicare say you have to do to be able to stay in a rehab and continue to progress, then they would say you are considered a long term care patient. And now you would just be transferred over to what is a nursing home. And a lot of people say, oh, now they're not doing any exercises with mom. I want her to have more exercises. Well, once they've already been told by Medicare that it doesn't seem that they're going to be able to progress, then they are considered a long term patient and they are not going to get any more rehab. So, if that's the case, as it was with this woman, and she is now considered in a nursing home, um, the nursing home says, well, she needs two people to move her from the bed to her wheelchair. That's called the two-man assist. Once you have a two-man assist, you can no longer go to an assisted living. So the family calling assisted livings, getting all the information, going for tours of facilities and saying, oh, yes, we'd like to pick this one. It has beautiful rooms and nice people and beautiful furnishings and looks like they have great meals and activities. It doesn't matter. Somebody who has a two-man assist is not appropriate. They're not going to be accepted into an assisted living. And so the assisted living was telling them, well, who can sign? What kind of paperwork do you have? Who has authority over this person? And no one did. None. The two daughters. Neither daughter had any paperwork because the mother said, not now, not now. We'll get it some when I'm ready. Well, the woman was 98 years old.
Wow.
And so
Wow.
now, so the only thing that they knew to do was to say she needs a guardian. And so they were asking me, can we get a guardian quickly to give the daughter guardianship? But the thing is that's not how it works. Guardianship is to go to court, and the courts may not give the guardianship to the daughter unless the mother says, yes, I want that person. And that still takes months. So if they were in court and the daughter and the mother said, I don't know who this daughter is, or that's my daughter, but she's just trying to steal my money, then the children would not get the guardianship. They would give
Wow.
it to a stranger, to a guardianship appointed guardian from the court, and still you may not have what you had hoped. So, the good story is I have a wonderful person. I just loved her so much. Was a woman who had she worked at a nursing home. She was the med tech, and she brought the medication to people. And when she started to have some physical issues, she recognized that she was experiencing early Parkinson's. And she continued to work up until a time when they were telling her that she was just, not able to do it. She was physically not able to do it. She was making some mistakes. And so they said that she would have to retire. Her daughter took her to look at a senior housing community, um, which gave her a great quality of life. She had a beautiful apartment, and she hired a part time aide. She also, her daughter happened to be a long term care insurance salesman and knew that she had set up a long term care policy for her mother so that they had no problem paying for the care that she needed. Also, because she was in that type of community, people were aware there was um, the doorman. If she would come down in the middle of the night and say, call me a cab, I have to go to work, the doorman would recognize that he could just turn her around and redirect, what we call redirect, as opposed to saying, oh, this is crazy, I have to call the police, and wind up sending her to the hospital. Um, she eventually developed, very severe, what's a type of Parkinson's dementia, where she was thinking that her children were still young, and she was saying things like, we have to go pick up food for the kids when they get off of school. And so eventually, I did help to place her in um, a memory care facility that had wonderful um, activities for people at her, with her level. But she did continue to have these different types of episodes, dementia episodes, really psychotic episodes. And so in where I live, there is a hospital, specifically a geriatric psychiatric hospital, that understands the conditions that are specific to this type of disease, as opposed to somebody saying, let's just put her out of her misery, or let's keep her quiet and restrained. They offered a a, a, a called a type of a treatment, which was electric convulsive therapy, ECT. And ECT is no longer like the old fashioned where people saw you get electrocuted. It's a very targeted therapy. And for several years, I was taking her once a week, then once every other week, and then eventually only once a month for the treatments. And after the treatment, she was back to her normal self. We would go out to have lunch. Um, there was money to pay for the facility, the treatment through the long term care insurance. There was money to pay for me because to pay for my services, which are private, but the family had access because they had power of attorney. So they were able to access her investments and her savings to pay for her care and to pay for my services. and to pay for us to go out to lunch and to make sure she had clothing and to have her continue to have a wonderful life as long as she did live.
These are, I have to say, these are two amazing stories. And, we have the tough one and we have the good one. And I guess what I'm learning from listening to you, and I hope my audience will learn as well. Look, we talk about doing this planning. We talk about a plan. You talk about around 65, hopefully someone's still healthy, where they have a plan in place. Hopefully, the first story has a much better ending than the one you're talking about, where someone does wind up in skilled or a rehab, someone's not working like they should work to recover from whatever the injury, the stroke, whatever it may be. And they wind up living in the back of skilled nursing that a lot of people refer to as a nursing home for basically the rest of their life. Because there's a word that some people hate, some people love, it's control. But you want to be in control, especially in the latter part of your life, where the second story, that noticing right away there were some health differences, but having that control throughout this process and having a much better ending than your client did with the first process. I talk a lot about when mom or dad gets ill, it's kind of like being on a roller coaster, and they normally are in the front car. You're following, everybody's screaming, the roller coaster's going up, down, sideways. And part of what I heard from this, you don't want to be in that back car. Maybe the one that's closest to mom or dad wants to be sitting with them in that front car, and they're working with each other to make this process that mom or dad is going through as easy as possible, and then hopefully come out with the ending that you talked about in the second story. So I appreciate that, and I thank you for those stories. I do want to switch gears a little bit. You and I talked briefly. You're using a terminology called aging icon. Can you explain what that is and what that's all about?
And so, when you feel that you have lived a long life doing what you love, and you feel extremely fulfilled by doing what you love, and you want to continue doing it, but something may happen. Maybe you have a heart attack. Maybe you given a diagnosis like Parkinson's. Maybe you had a fall and it was a scare. I had um, a car accident, not with another car, but I just had a number of times where I was swiping things. And it did cost me quite a bit of money in my car insurance to take care of that, to where I realized that I probably shouldn't be driving. And so I thought, what, people were saying to me, because my husband had recently passed, and people were saying, well, you're going to retire. You're going to Florida. You're just going to be out doing what you love. You like to fish. And, yes, that all sounds nice for a great vacation. But I really love what I do. And I did not want to um, lose all of these stories and the knowledge that I had, and the people that I've been able to help that have said, what would I do without your services? What would I have done without your help? And that's so rewarding to me. And saw that there was really no reason that I couldn't do that from my chair here on Zoom or by the telephone. And so I realized that I could do things just in a different way. And I took some courses because I like to take courses. Uh, One was to talk about my personal mission. What did I want out of life? Nothing to do with how to push my business going forward, but what did I really want out of life? And I realized that I wanted control. As you said, I wanted to still have control. I realized from hearing from my clients, the thing they hated most was giving up control of what they wanted to do, whether it was just getting in the car and going out to eat whenever they felt like it. They didn't want anybody telling them that they couldn't do it. Well, a lot of that had to do with if you have planned and done and have your financial, yes, I can afford to have a driver. I can afford to go out to dinner. I can afford to go to Florida and take a flight and stay in a nice hotel and do the things that I want to do when I get there because I planned for when I was not able to do things. But I really didn't want to stop doing the things, the real important things that I love doing. I didn't want to just, I'm not a child. I'm not looking to just go out and play every day. And so uh, one of my coaches um, said, "Oh, you work with icons." And I said, "Yes, that's it. In fact, it's aging icons." And so I started using that term and referring to my situation as I'm an aging icon. And then I found that I was able to talk to people about their passion and use that model to describe what I had been doing with my clients, but then just talking to people individually and saying, do you love what you do? Oh, yes. I mean, I'm talking to people who, I just spoke to somebody who had a big moving company. And she said, when I think of icon, I think you're talking about Martha Stewart. I said, well, Barbara, I know that you have a wonderful company. You've built a fantastic company. It isn't just you, you have a lot of employees and you have a lot of moving parts. Um, are you still able to do everything the way you were doing it when I first met you 25 years ago? She said, no, in fact, I really am getting very frustrated that I don't want to do all of these things. And then I asked her, are you, would you be fulfilled if you had to just leave and just sit around and do nothing? And she said, no. And little by little, she started to realize that she was an aging icon. So that is the idea, that is the concept. Aging icon is a concept to get people to see themselves if they are. I'm not saying that everybody is, but it does not have to be a famous personality. It's a person who feels that they have something, a passion, a mission in life, and they want to continue doing it regardless of the obstacles in their way.
Wow, that was that was fantastic. I mean, I love that concept. I love the stories you're talking about. Um, I want to make sure my audience is aware of this and how to connect with you. So my next question is, if someone does want to connect with you, is there a website, multiple websites, a phone number? What should they do?
So they should go to agingicon.com. It's a icon singular, agingicon.com. And my phone number is there. Some information about are you an aging icon? And I like to speak to people one on one just to find out what you've done so far. Because many times I can just explain to people how the system works. In what we talked about in that first scenario, if there's really So, if there's nothing really that I can do for them, I can let them know right away. But many times I can tell them simple things, easy things that they can do themselves. And I said, I'm not somebody who had learned this at school. There was no certain license to be able to do this. It's really understanding, being able to listen, being able to do the research. Um, I can walk people through it step by step, and there's no fee to call me because I just like to have people do this before they have to call me and say, I wish I had heard about you a year ago when my mother was going through this. So I love to do that. And then I do take private clients who are know what they want and have the means to do so.
So, Caryn, I very much appreciate you coming on today. I very much appreciate this conversation. Been very enlightening. I hope our listeners have learned a lot. I have some good stories, some tough stories, but they're stories and they're called real life. And there is a way, as we talked about, through planning to get ahead of possibly the tougher ones. So the outcome is a little bit more of what you want and your family wants. As we wrap up, as I normally do, I'm about to give you an email, folks, where you can reach out to me. I encourage you, if you have stories you want to share, whether they're personal, whether they're professional, working with clients, working with patients, please reach out to me. And do you have a pen, folks? I'm about to give you the email. It is eldered2023 at gmail.com. ELDERED 2023 at gmail.com. Once again, I thank Caryn, and as I always sign off, folks, make sure till we talk again, you have an awesome day. Bye bye.